Pulmonary rehabilitation is essentially rehab for your lungs, right? So most people are aware about cardiac rehab after they have a cardiac event, or pulmonary or physical rehab after orthopedic surgery. Same way people with chronic lung diseases need rehab for their lungs. It is a comprehensive intervention which is tailored based on individual needs. So every patient gets their own assessment done, and then a special program is developed for that patient's specific needs, which includes exercise planning, which includes education, behavioral interventions, and the whole goal is that ultimately patient come out of it with better exercise tolerance and better physical and mental well-being. Patients with COPD, right? It is actually studied and proven that people who undergo rehab who have COPD have better exercise tolerance, and they also have shown that people who have had exacerbations, which is essentially a flare-up of your COPD, and you end up in the hospital, people who undergo rehab have less chances of having a second exacerbation. And also it actually has shown to decrease the mortality in people who've had exacerbation and they started rehab soon after discharge. So it's very beneficial. And not only it helps you in the short time period you are doing a rehab equips you with the tools, with the breathing techniques, which will help you way beyond after you have graduated from a program. And that's the beauty of doing pulmonary rehab. And actually, nationally, they looked at, in overall, all the patients under Medicare who have COPD, only about 3 to 4% of the patients are utilizing pulmonary rehab. And then out of those people who have exacerbations with COPD, only about 2% end up enrolling in rehab. That's why it's really important to get the word out so people do understand the importance of rehab and how it truly can add so much to something such a basic thing as be able to breathe. But it's not just limited to people with COPD, right? So as I said, anybody with chronic lung disease can have it, and that includes a whole spectrum of diseases, right? People with interstitial lung disease or restrictive lung disease or pulmonary fibrosis can benefit from it. People with post-COVID symptoms are people who definitely benefit from pulmonary rehab. So people who are still symptomatic and they had COVID recently or in the near past, they should seek out getting pulmonary rehab. Referrals into pulmonary rehab has to come through a provider, right? So self-referrals do not work for pulmonary rehab. So my recommendations are anybody, from a patient standpoint, anybody who is suffering from a chronic lung disease and they're symptomatic should talk to their either primary care provider, their family physician, their pulmonologist to refer them to a pulmonary rehab program closer to where they live, right? Everybody is welcome to come to the UK Healthcare Pulmonary Rehab Center, but that should not be the deterrent, right? If it's not feasible to come here, please go to the nearest pulmonary rehab program and take the benefits of this. Here at UK, we are an accredited program by the American Association of Cardiovascular and Pulmonary Rehab Organization. It's a national organization which sets the gold standard for all rehab programs, be it pulmonary or cardiac. You have to meet certain standards and quality metrics to, number one, get that accreditation and then to maintain it, right? And it is only possible due to a multidisciplinary team we have here. We include respiratory therapists, we have physical therapists, we have exercise physiologists, we have nurses, medical assistants, the front desk people. So we have a whole variety of people which work together to deliver what we have, and as a testament to their hard work, we consistently are in the top 5% of the national average of patient satisfaction surveys. So I think that's something to be proud of and something we really cherish. The group of people we have, they're excellent. They are great at their job. It's a very well-run, well-gel facility, and it's the people which makes it what it is right now, right? And then obviously UK Healthcare provides the tools we need to be successful. So we have all the state-of-the-art equipment and everything a program would want. And then it's the patient's dedication too, right? People who actually show up, they love what we do, and then and they just want to get better, right? So it's a combination of the effort patients put in and the wonderful work my team does. So we get the results.